Now, one of the things I promised to tell you about was to talk more about the difference between a delay and a disorder. Now, these are words that you'll often find if you've got a diagnosis from your speech pathologist saying that your child has a speech delay or has a speech disorder. Now, sometimes that can get a little bit confusing. So I'm going to explain to you today what that means. So let's start with delay. So a delay simply means that your child is following normal development. It's normal development, but it's slower, okay? So it means that, for example, they're doing things that a younger child would do that are totally normal, but they're just taking longer to reach those achievement milestones than other children their age. So that's a delay. Now, with a delay, we know that those kids will sometimes be able to catch up, particularly if they have a delay in first learning to talk, but we also know that they're at very high risk of having high level difficulties even later in life. So that's why even with a delay, it's important to get therapy. Now, the other one is a disorder. Now, this always sounds a bit scary when you hear that, because it makes them sound really broken. But it's a really important way for us to be able to differentiate between kids that are developing normal patterns but just behind, versus those that are following a different pattern. So if they're disordered, it means they are following a different pattern of development. So for example, if you had a child who was saying I for every syllable in a word, that would be a disordered speech error, whereas saying t for k would be something that would be a delay. So if you had, for example, a child who was saying caterpillar, was trying to say caterpillar, and they said tatapillar, that would be a delayed speech error if, say, they were 5 years old and they should have resolved that. They should know how to make the k sound by now. So that's a delay if they're saying caterpillar. Now, if they're saying I, that would be a disorder. Now, disordered speech errors also make it harder for us to understand. For example, when someone says caterpillar, we can kind of go, oh yeah, I know what you're trying to say. You've just used an error there, so you just sound like a little kid. Whereas with a disordered pattern, it makes it much, much harder to understand what they're saying. So another example might be with caterpillar. If the child said a s instead of a t for a k, then that would be disordered in that it's not normal to make a s instead of a k sound. That's not something we see in younger children. So if they were saying satapillar, you would be going, oh, what is that? Sat on a pillar? Like, it makes it much harder for our brains to actually decode what they're saying. So children with disordered speech errors are usually harder to understand than children with delayed speech errors. And a delay, there's a possibility that you may catch up, but you might have some high level difficulties later in life. Whereas with a disorder, really critical that you get intervention, because it's highly unlikely that you'll be able to spontaneously resolve without treatment those speech errors. So if you're seeing some unusual patterns in your child's speech, get them into a speech pathologist as soon as possible. Whereas if they're just behind for their age, definitely seek treatment, but it's potentially something that's a little bit, I guess, less concerning long term. But be aware that those kids are still at risk of reading difficulties, social difficulties, and other learning problems. So it's really important that you get help early so that you can give your child the best chance to talk, eat, play and learn to the best of their ability. I hope you found this useful, and I'm interested to know, has your little one been diagnosed with a delay or a disorder, or have they used a general term like difficulty or problems? I'm really curious to hear, so let us know in the comments below. Take care. Bye-bye.